Your client comes to you with an observation. What do you do? These are just the types of questions that we talk about in our mentorship call. So this happened to me. I had a client who sent me an email and noticed something interesting. She noticed that when adding fruit back into her diet, per my suggestion, she felt crashes and even oral sensitivity to sweetness. However, restarting her Ozempic as guided by her provider, that response disappeared. Before you hang on one word of that last statement, I am going to ask you to take a big step back and zoom out. There are so many directions I could have gone with this. However, as opposed to fear or fixating on one thing, I decided, as I tend to do, to take my client along on an observational approach that it could explore possible correlations, none of which exist in isolation. I brought up factors such as type of fruit, ripeness of fruit, portion size of fruit, even how it's paired with meals. I also shared some interesting kind of food considerations that I have seen anecdotally. None of these as a rule, none as a immediate fear-based thing, but just some things worth noticing. In fact, I'm pretty careful in saying, hey, this is not bad or good, it's just a thing. For newer coaches and maybe those who feel like they haven't had a lot of experience, I'm gonna say, this is an approach to consider, and this is one that we definitely talk about a lot with our mentorship coaches, is take a pause, gather more context, and then help guide the client towards what could possibly be happening. We personally believe that coaching is about helping clients develop their awareness, develop confidence in their bodies. The biggest thing that I see is that if we can do these things, then we are helping a client be recognizing what is in their control. That is powerful. So if you're interested to see my exact response to this client, check out the caption.